Hi everybody, my name's Kate. I'm the Skills Coordinator at Community Chesterfield, who have helped to organise this event and are hosting today's session. Can I just ask each of you as panellists to introduce yourselves just by saying your name and your role in one sentence? And I'm going to start with Denise first, please.
Morning, everybody. My name is Denise Baker. I work at the University of Derby, where I am the Interim Deputy Dean in the College of Health, Psychology and Social Care.
Lovely, thanks very much, Denise. Jackie. Jackie, you just need to unmute yourself.
There's always one, isn't there?
It wouldn't be an online session if there wasn't.
Yeah. Good morning, everyone. My name is Jackie Willis. I'm Chief Exec of Derbyshire Voluntary Action, and I'm responsible for the innovation and smooth running of the organisation. And our organisation's aims are to support and represent the health and social care, voluntary and community-led groups and organisations across Derbyshire.
Wonderful, thank you, Jackie. Linda.
Good morning, everybody. My name's Linda Garnett. I'm the Workforce and Organisation Development Lead for the Derby and Derbyshire Integrated Care System, which is known as Joined Up Care Derbyshire. And my role is to work with our partner organisations to make sure that we get the right number of people with the right skills in our health and care organisations to provide the care that our citizens need.
Thank you very much. And last but definitely not least, Emily.
Hello, good morning everybody. I'm Emily Williams. I am the Skills Delivery Officer for Chesterfield Borough Council. So I sit within the Economic Development Unit within the Borough Council, and I lead on skills and employment activities for the borough.
That's wonderful, thank you. Just bear with me. Would you each just be able to sum up what your specific role involves and what your organisation does? So I'm going to go, we'll do a slightly different order. I'm going to start with Jackie this time, please.
My role is to lead Derbyshire Voluntary Action. I am employed by our board, as all charities are. We're a registered charity and a company limited by guarantee. We work right across Derbyshire strategically. So I work with people like Linda. We work very closely with Joined Up Care Derbyshire. Our role is to promote, represent and support the wider voluntary and community sector. So that's from very, very small self-help groups up to large organisations and national charities that you will see and hear a lot about, but particularly the diversity of those organisations and supporting those smaller charities is a fundamental role of Derbyshire Voluntary Action.
That's wonderful, thank you, Jackie. And Linda.
Yeah, so Joined Up Care Derbyshire, it's a partnership. It's a partnership between health organisations ranging from hospitals, family doctors, urgent treatment centres, mental health teams, and local government, local authorities, police, fire, rescue, and really importantly, as Jackie said, the voluntary sector. And our overarching aim is to improve the health and well-being of people in Derby and Derbyshire.
Wonderful, thank you, Linda. Denise.
Thank you. I'll start off by saying that my background is diagnostic radiography, and when I left school, all I really wanted to do was find out how the human body worked. And now, some 30 odd years later, here I am sitting in the University of Derby. So as you might imagine, the university is about training people to get into the roles that we need in our community. But I feel that our role is far bigger than that as well. So we link with the organisations around Chesterfield and in Derbyshire and the wider area to make sure that we secure a pipeline of people coming through who've got the right skills that they need. And there's the makeup of that might not just be higher education. If people need to go through further education as well, or if they need some careers advice, that they were, like me some 30 odd years ago, interested in finding out how the human body works, allow people to explore what those opportunities might mean and what opportunities there are for them going forward. So we're here to deliver the education for people that want to get into health and social care, but also to support the workforce who are already working in that arena and help them develop further skills.
That's wonderful. Thank you, Denise. We did actually have an event earlier in the week from radiographers. It was absolutely brilliant. So yeah, thank you. And Emily.
Okay, thank you. As I said earlier, I work for the local authority in Chesterfield Borough Council, and I sit within the Economic Development Unit. I lead on skills and employment activity, which covers a wide realm of activity and involves working with a wide range of different partners and employers, including our skills providers, both schools, further education and higher education, and also the voluntary and community sector. We're enjoying a good level of growth in Chesterfield at the moment, and my role is to support the ambition of the borough to secure long-term growth across the borough for our businesses and residents, and to do that it's about ensuring that individuals have the right skills to access current and future opportunities, and also through the delivery of inclusive growth as well. So that's my role in a nutshell.
Wonderful. Thank you very much, Emily. I'd now like to introduce our special guest, Toby Perkins Mp. Toby, if you'd just be able to introduce yourself and quite a big question, but share your vision for health and social care in our local area. And if you've got any words for those who are considering a career in health and social care. Don't worry.
Well, thanks, Kate, for that, and great to hear everyone else who's on the call. Hi to those that I already know, and nice to meet you to those that I don't. Yeah, my name's Toby Perkins. I'm the Member of Parliament for Chesterfield. I'm also the Shadow Minister for Apprenticeships and Skills. And so I'm obviously here in two different perspectives today. First, as somebody who has a great interest in the care industry and its importance to my constituents here in Chesterfield, but also as someone who is responsible for the Labour Party's approach to skills policy, to trying to attract the next generation of carers into the industry. And to trying to ensure that we have a situation where people who are taking on an incredibly important role in our society that's absolutely fundamental to both the quality of life of people, vulnerable people, the quality of life of their families who are worried about them in the event that they're not getting care, but also to support people in some circumstances to be able to maximise their own strengths to recover and to get back into the world of work. So in a variety of different ways, carers play an incredibly important role. And as the MP and as someone with a particular focus on skills, I'm very conscious of all of that. I'm also very conscious of particularly the challenges in social care, because prior to being a Member of Parliament, I spent a year in Sheffield, where the Sheffield reference comes from, as a branch manager of a social care organisation providing care to elderly and vulnerable people across Sheffield. So I know firsthand how important and life-changing that role is. I know how tough it is to recruit and retain staff in those fields, and I know how rewarding that work can be as well. So I have a number of different perspectives coming into this. And many of my constituents have contacted me over the years regarding the needs that they have with their health and social care. I know how reassuring it is to them and their families when they receive the support and the help that they need, and also know how stressful it is when they're having regular changes in carers where they're unable to be certain about which carers are coming, and the pressures that puts on particularly people with dementia, but also other people in need of care and their families. And throughout the pandemic, health workers have gone above and beyond, and it's demonstrated, I think, how much we all rely on them. It's highlighted how much we need dedicated, compassionate people in those roles. And I think what's been particularly important in this pandemic is that where there's been a long-standing recognition of the value and the prestige in which our nurses are held, I think the role of carers has come very much more to the fore in the course of this pandemic. And whereas previously you'd always hear people talking about nurses, now you're much more likely to hear people talking about nurses and carers. And so I think that's been incredibly important and valuable, that there's been this recognition of the role of carers. So, as they say, it's an ill wind that blows no good. And one good that has come from the pandemic, I think, is the recognition, not just amongst the public, but also amongst the sort of governing organisations about how fundamental carers are to the success of our health system and to the success of our society. I'm sure many people were mentioning today, careers in health and social care are incredibly rewarding, and they make such an important difference to people's lives. We're fortunate to have wonderful educational institutions such as Chesterfield College, such as universities locally, but also independent providers who play an incredibly important role in recognising and recruiting people into these sectors. And they offer excellent courses to develop the skills and training needed for many careers in this sector. And I recently met with Unison to discuss opportunities for healthcare apprenticeships, and they highlighted that there are currently as many as 100,000 vacancies across the NHS. So, there's never been a better time to start your career and see how you can progress. And I think one of the great things about the care sector is that it is a sector that obviously has a wide base of requirement at the bottom, but it also does have progression possibilities. It does also enable people to work in the public sector through the NHS or local authorities, or in the private sector through independent providers. Some people start off as a carer and end up as a business owner running care companies themselves. So there are many different ways in which people who join the care sector can end up developing their careers. But I think it's also fundamental to stress and to understand that it really is a career for someone with empathy, with a desire to help people. It isn't just about a career selling paper clips or repairing windscreens, or whatever those other jobs might be that are important, but maybe don't touch in the same way on people's lives. When you are a carer, you are responsible for going into the home, for supporting the needs of people who, without you, would literally be in a desperate situation. And so that desire to really make a difference in people's lives is an incredibly important one. I'm delighted that we've got such an excellent panel here, and I very much look forward to hearing what other people more directly in the sector right now have to say during this discussion. But I hope what it does is help people to realise, whether they be a professional currently in the sector or someone considering this line of work, that this work is very much respected, it's very much needed, it's very much valued, and it is a very rewarding and potentially lucrative and career progressing area of study and career for people to go into. So thank you ever so much for the invite to attend. I look forward to handing over to the other panelists, and I'm looking forward to hearing your views and any questions that people might have at the end of the session.
Wonderful. Thank you very much, Toby, for that fantastic opening to this event. I think that what I heard there is that careers in health and social care are both valuable and valued. And that's obviously really important. That was brilliant. Thank you. I would like to move on now to ask some of our panelists, what strength does our local area have in relation to health and social care that are going to help us in the recovery from the pandemic? I know that feels like a massive question, but it's obviously the one that is on the forefront of everybody's minds at the moment. Emily, would you be able to give your views on that, please?
Yeah, absolutely, and a pleasure to be able to answer this first question. In terms of Chesterfield, we're very lucky. There's a very strong sense of community in Chesterfield, and we have a particularly strong public sector, which will go a long way to support the recovery following the pandemic. Likewise, we're fortunate to enjoy a number of very strong local alliances. So just some examples of those include the Local Health and Wellbeing Partnership Board, and also the Place Alliance, responsible for the joined up careers in Derbyshire. But we also need to remember our employers in Chesterfield and North Derbyshire. Some of our largest employers operate in the health and social care sector. I can't mention all of them, but just to mention two, there's obviously our Chesterfield Royal Hospital and the Heathcotes Group, who are head office here in Chesterfield, both of which offer a wide range of employment opportunities, including apprenticeships. Both those organisations are apprentice town ambassadors for the town, who support us in our ambition in raising awareness and increasing participation in apprenticeships in Chesterfield across a wide range of areas, including healthcare and support work, but also business administration, finance, clinical engineering, decontamination. We haven't got enough time to list all of them, but an absolute wide range of apprenticeship opportunities in this particular sector. Looking at employment, Toby mentioned this earlier, there's a huge demand for staff across Chesterfield and North Derbyshire at the moment. A recent analysis of vacancies between March this year and May this year showed that there were 4,166 unique job postings just across Chesterfield and North Derbyshire. Massive, huge amounts of opportunity. And also we need to remember that Chesterfield is blessed with a strong network of training providers who offer a wide range of pathways from entry level all the way up to degree and postgraduate level education. So we have Chesterfield College here in Chesterfield, who offer health and social courses, health and social care courses from level 1 diplomas all the way up to foundation degree level study, and a lot of college students also undertake the Access to HE course, which will take them on to university level study. And of course, we're blessed with a campus here in Chesterfield with the University of Derby, where a number of health related degree courses are offered, from nursing, but also social work, child and family healthcare work as well. And as Toby also mentioned, Chesterfield's also a number of independent training providers who offer specialist health and social care provision from level 1 through to level 3. So for me, I could go on, but they're some of the strengths that I just wanted to highlight that Chesterfield has in this sector.
Thank you, Emily. That's really insightful. I think I definitely agree with you. One thing I've learned from this week is that there are a huge variety of careers within health and social care that I just wasn't aware of. There's, like you said, it's not just nursing or just caring. There is a huge variety there, and the option for apprenticeships and all the different varieties of routes into health and social care is the other thing that we've been really keen to highlight this week. I agree as well that there's such a huge sense of community in Chesterfield. I've lived in lots of places. I've never lived anywhere quite like Chesterfield. There is that real sense of community. And just moving on, talking about the community, Derbyshire Voluntary Action are obviously a big part of that community, Jackie. So do you have any answer to kind of the strengths that our local area has in relation to that community and DVA that are going to help us in the recovery of the pandemic? You're on mute, Jackie.
I'm being such a good girl, keeping myself on mute, and then I forget to take it off. So thank you everyone for showing an interest in health and social care. As I mentioned earlier, DVA's role is to support, promote and represent voluntary community groups and work to integrate their services into the wider healthcare system. So we help them to build partnerships and lead by example. We've great working partnerships as proven by our work with Derby University. We work really closely with Chesterfield College and Chesterfield Football Club around young people's social prescribing. So why a career in the voluntary community and social enterprise sector, and what can that do to help people to come out of the pandemic? So first of all, the most important thing is we really care. So most charities and community groups start out of a passion or need. We are bound to local communities and their activities. We've a proven track record in supporting people through lockdown, providing a lifeline to isolated people with shopping services, befriending services, support with picking up prescriptions, just check-ins, dog walking, all those sorts of little things that people struggled with throughout lockdown, and those things will continue until we're in a much better place. We're still doing those sorts of activities. So as we move forward, people will need help with their mental well-being and confidence to reintegrate back into the activities they used to do. We're seeing a lot of people that have been, housebound or been in their homes for so long, the mobility has decreased, and there's a lot of activities that we're looking to do in the future, working with our groups to actually get people to just come over their doorstep in some instances. So people are reluctant to come out, they're scared to come out. We hear all the stories about, about new variants and that type of thing. We really have to do a massive job on confidence building and using our groups and organisations to help support people to be back and integrated and happy and networked to their communities. We're professional, so we are well trained. We're confident in delivering our services. We are keen for people to know more about the types of services we do and we can offer. We're diverse. So locally, there are hundreds of charities, social enterprises and informal groups of people working together on the ground to make life better for people, and again, like I say, to be more integrated, to be supported and to feel confident in where they live and in their social relationships. There's a charity or a voluntary sector or a community-led group that you can link to every medical condition. I can't even think of one that there isn't some support around, plus mental health, plus autism and learning disabilities, you name it, you can find support out there in the community. We're flexible, we're incredibly flexible. We respond to instant notice sometimes. We're not massive organisations usually, so we can flex, we can change, we can grow, we can provide different support. And again, COVID has really shown how we've done that. There's been so many mutual aid groups spring up of people just really wanting to help their neighbours, and that neighbourly approach is so important to the community sector. And we're becoming more integrated, and this is where we link in with Linda. So the voluntary sector is working really closely. So organisations like myself, which we call infrastructure organisations who support other voluntary groups, we're working really closely with our Joined Up Care Derbyshire colleagues at the highest of levels. There's a real move now for all services to work better together, working across organisational boundaries, and the voluntary community and social enterprise sector is vital for this to happen. It's well recognised now. It's actually coming into the integrated care framework that the government are developing at the moment, and this is really about working across organisational barriers. Linda will tell you more about this, I'm sure, but it's really vital, and the pandemic and COVID has really shone a light on the value of community, what we can do and how we can work with our NHS and adult and children's service colleagues to really make sure that people are well supported at all levels, and so nobody falls through those gaps, because lots of people do at times. we really focused on those really vulnerable and isolated people in community. I think there's lots more about the voluntary sector. I could go on for years, literally,
Lovely.
but I'll stop there.
Thank you so much, Jackie. The key points there, I think, are the joined up working that you talked about. That, you know, that's the key, isn't it? If you're talking about health and social care, that is the key, and it's something I think we're really good at in Chesterfield. And the fact that you are all here on this panel is an example of that. And the other thing is where you said about the fact that the voluntary sector is professional, and that if people are considering a career in health and social care, working within the voluntary sector is also an option. So that's something to consider. Toby, did you want to give any comment about what Emily or Jackie said?
Yeah, I mean, I think slightly distracted by a kitten that's not particularly understanding Zoom calls at the moment. Yeah, I would just say that, I mean, I think I would absolutely concur with what was said about the strength of the public sector here in Chesterfield, and about the excellent work that the voluntary organisations and the independent providers also play. I think, you know, the point I made earlier is really worth stressing, that care is kind of a cross-cutting responsibility. Of course, there's a statutory responsibility on the public sector, but, you know, without the independent and voluntary sector, and of course, without a whole army of unpaid carers who in their own families are contributing. And often people will start off being a carer in their own family and then decide at some point in the future that they want to do it as a career. Without those many different contributions, the system simply would fall apart. So, you know, I think that the comments that both Emily and Jackie made, you know, fit in entirely with what I was thinking about Chesterfield's sense of community, about the strength of its institutions, about the strength of its voluntary sector, about the strength of working together that we have here. And it's not always the case in other areas that you find the public, private and voluntary sector working collectively together. And that doesn't mean that we're perfect, of course we're not, but there are a lot of good practice across those different sectors in Chesterfield. And I would just, end, I guess, where I started, which is saying, you know, to anyone considering this line of work, it is a line of work that is absolute crucial importance, of tremendous value, I think incredibly rewarding, and does have real potential as a career, but is also one in which, you know, every day new challenges will face you, awfully difficult circumstances will face you. You know, it's not an easy line of work by any means, but it is one that I think is valued and rewarding. And so I would encourage anyone who thinks they could make that contribution to do so, for everyone's good, but also because of the value it will bring to them, I hope.
Thank you, Toby. Yeah, and that leads perfectly into our next question, because I could hear you talking there about the difference that career in health and social care makes. And interesting, my route into health and social care was exactly that, family, and then, you know, I've ended up working in health and social care my entire career. So it is, I think, a common experience. But just leading on from that, we want to ask about whether, as panelists, you would recommend health and social care as a career to someone who wanted to make a difference. So Denise, could I just ask for your views on this?
Yeah, Kate, of course you're going to make a difference. And I think I started off by saying that I came into radiography almost by accident because I wanted to know how the human body worked. But I very quickly realised that the skill that I valued more than anything was about making a difference. And the ability to hold somebody's hand when they're frightened, or to reassure them when they're uncertain, it's a privilege, really, to think that you've made that difference. And I can see now, in the role that I'm in the university, that we have people that almost fall into health and social care careers by accident sometimes, and they maybe start off in that voluntary sector and realise that they enjoy working with people and that they're interested to find out more about a particular sector of society. And health and social care is that sum of all of those different skills and different interests. So I feel as though I'm one piece in a jigsaw, really, if I'm thinking about my career as a diagnostic radiographer or about my academic career. But we need all the other pieces of the jigsaw to come together. And then there are some amazing roles that don't have a title like radiographer or nurse or carer, that operate in the background, but are really the glue that bring everything together. So I would suggest to people, think about what it is that you think you're interested in and where you think your talents lie. So if you're interested in people, and I think you'd have to really struggle to find people that aren't interested in people. If you think that you're a communicator, a good communicator, if you enjoy working in a team, you've got that skill set that will be really valuable in health and social care. And the pandemic has demonstrated a couple of things to us. First of all, that human-to-human contact is so important, and that's what we've really lacked. And we know that in health and social care, we know how important that is. But also, we've seen a lot of people that have been displaced, or who perhaps weren't ever thinking that they wanted to work in health and social care. And how can they get into that? And those voluntary sector roles are really important. Working in social care, we've heard on the news how important social care is and how much we need people to be working in social care. And Toby spoke very eloquently about how rewarding that is. And it is a privilege to go into somebody's home, into somebody's life. But that's a great step onto that ladder. But I don't want people to think that you've got to move through the different sectors. If you find your niche in social care, then you should stay there, because you will really make a difference. If I found my niche in radiography or in research or in education, all of those great options are available for people to come through. So absolutely, you can make a difference. And we would not be where we are now in terms of the pandemic if we hadn't have people who wanted to make a difference and who thought it was important to care.
Thank you so much, Denise. That was incredibly well put. Thank you. Linda.
Thank you. And yeah, I totally agree with everything Denise said. I think that was absolutely great. So we have 60,000 people who work in health and care across Derbyshire and Derby, and that ranges from some really large employers like the University Hospitals of Derby and Burton, who have 13,000 employees, Chesterfield Royal Hospital, who you mentioned, who have 4,000, right down to small care homes and voluntary organisations who've probably got less than 20. And within that, we have over 350 different roles. So there really is something for everyone, whatever your interest, as Denise said. And I think all our roles require different skills, different levels of training. There are so many routes that are open to people to go into roles now, whether it's through apprenticeships, whether it's through a degree qualification, or whether it's through volunteering, which is a fantastic way to actually work out what it is really is best for you and where you can be your best. And that's what we want. We want to have people who, as Toby said previously, yes, we need empathy and a desire to help people, but what we're also looking for is people who are proactive, have got a can-do attitude, good interpersonal skills, like working as part of a team. Because I think one of the things that people really enjoy about working in health and care is that sense of teamwork. And you're working with so many different people. and some of the relationships that develop between colleagues, between service users, are so strong and powerful. And I would say that, yeah, supporting people to live the best life they can is incredibly rewarding. And people stay in these jobs, people stay working in one organisation or in the overall health and care sector for their whole careers. And I think one of the reasons for that is that we take support, training and development of our workforce really, really seriously. There are some fantastic training opportunities, and you know, I think that is a real strength of working in health and social care. If you find the job that you like, then that's fantastic. We'll support you to be the best you can be in that job. But if you've got potential and aspirations to do something different and to develop, then we'll do that, and we'll work with you to do that too. I think one of the other things probably just want to say is that we take our role in health and care as anchor institutions in the community really seriously. And actually one of the things that we know makes the biggest difference to people's overall health and well-being is having a meaningful job and having that sense of purpose. So we're really, really focused now on looking at how we can make good jobs available to people in our communities, and not necessarily need to look elsewhere. So that's something that we feel really strongly about. We've been overwhelmed actually during the pandemic by the level of support that we've had, and by the level of interest that there is now in working in health and social care, which is fantastic. But please don't feel that we still don't need people, because
yeah, absolutely.
We're all, you know.
No, I was just going to say that's absolutely true. Yeah, people are still definitely needed. And I resonate a lot with the fact that you said about having a can-do attitude and getting involved in the fact that people as individuals, we need a sense of purpose and a meaningful role. And that actually does lead really nicely onto our next question, which is about what kind of action someone who's watching right now could take to make a difference to health and care in their community. So to answer that, could we go to you first, Jackie, please? You're on mute, Jackie.
Sorry about that, everyone. Okay, so but I would say, first of all, the first action to take is to do a bit of research, because as I mentioned before, the voluntary and community sector is so diverse, and so are the opportunities in the rest of health and social care. It's a fabulous place to work. It's a caring place to work. In terms of voluntary community sector, I would say, I'll just mention some of the diversity of the roles. You could be a development worker, so that's somebody who support groups and their members at very much ground level. You can be a support worker and care very directly on one-to-one with individuals, for example, people with learning disabilities. You can do some frontline clinical work, so organisations like Fair Play, who support children and young people with physical and life-limiting conditions. Ashgate Hospice Care, the same. Very clinical staff down to volunteers, every kind of opportunity you can imagine in both of those organisations. Fundraising, you can get involved in training and skills development. You can help with infrastructure support and group development, so that bigger picture of actually helping to sustain or grow or set up a new group. There's many admin type roles, finance officers, there's engagement workers, project managers, senior management roles, trustee roles, so volunteer roles, as a trustee of an organisation. We mentioned volunteering before, really crucial. The trustees and the boards of directors of voluntary sector organisations employ the staff, so it's a very, very important role. You can run an organisation, so you can become a chief executive or a senior level manager. I mentioned project managers. I think the most important thing for me is to speak to people that are in those organisations, ask them, go visit them, ask about the opportunities, see the type of work they're doing, see the type of people they're supporting, consider volunteering. It gives you a great insight whether you're working in a profession, you want to change profession, or you're starting off on your career. Fabulous way to just understand what happens. You can talk to people that work in those sectors. They'll support you and help you to learn about the bigger picture of health and social care. So if the voluntary sector isn't for you, you'll understand about all the other opportunities out there. And an offer from Derbyshire Voluntary Action is, if you're interested and you're not sure, look at our website. There's a database on the front page of our website, that's dva.org.uk, but also you can contact us and we'll introduce you to any of those groups or themes or ideas of where you might want to work. We can help and support you and make those introductions.
Wonderful. Thank you so much, Jackie, and for that great practical tip there. Well done. Thank you. And Emily, could I just ask the same question of you? So kind of what action can people take to make a difference in their communities?
Yeah, absolutely. I echo everything that Jackie said there. And actually, there's not a huge amount I can add to that, because I think Jackie very eloquently covered a wide range of actions that we can all take to make a difference. What I would say is we can all help to recognise the hard work and the sometimes challenging work that staff in the sector are undertaking, and you know, we can do things like share positive experiences and good news stories. We all come into contact one way or another, whether it's through careers or whether it's through family, with the health and social care sector. And I think actually we can, you know, talk the sector up, share positive good news stories. Not only will this help staff in the sector feel recognised and appreciated, it will help raise the profile of the sector as a great place to work, to start or develop a career. So I think, you know, that's something that we can all do. Another thing we can all do is help reduce the burden on the sector at the moment, and just continue to remember to follow COVID guidance, hands, face, space, fresh air. That will help. And again, I think Jackie mentioned this. There's lots of volunteering opportunities that people can undertake, explore, research, talk to training and education providers as well. So I'm not going to add much more because I think Jackie actually covered everything, but I think it's just about continuing to support the sector locally and the work that they're doing.
Yeah, that's wonderful. Thank you. We're incredibly passionate about talking the sector up, and that has been the big purpose of this week, actually, Careers That Care Week, is that kind of bigging up health and social care. You know, we all work at it, we're all passionate about it, want to share that with everybody. And throughout this week, we have showcased some of the diverse roles within health and social care. But I'm just interested to know, because as I said at the start, there were roles that I even within the job I do wasn't aware of, particularly within healthcare, I suppose. So are there any other kind of really interesting careers or opportunities that that you'd like to highlight, kind of roles that are available within health and social care? Linda, would you be able to answer that for us?
Gosh, that's a hard question. It
is.
It really does. What I would suggest to people is there's two websites I'd like to mention. There's the Joined Up Careers website, which is joinedupcareers.co.uk, and that is our ICS website, where we've got absolutely everything you could ever want to know about different careers, different ways to get into working in health and social care, links to lots of other websites. But one of the things in particular that people might like to think about is how to get some experience of these different settings and different roles, which is not always easy, but we have got a virtual work experience programme called Future Talent, Future Heroes, which I would really recommend people have a look at, because that will really give you a really good introduction into the range of roles that there are, and actually enable you to kind of, you know, feel it for yourselves about what it's like. And then I would also absolutely echo what Jackie said about looking for volunteering and different experiences in the local community, because we're not only interested in people who, you know, have had work experience as a nurse. You can learn so much from helping others, from working with others, in the local community, in care homes. That is a brilliant way of testing out whether or not direct care is something you really feel you want to do and would enjoy. So don't feel like you have to have experience in a hospital or in one of the better known sort of areas of healthcare. What we're interested in, as we said, is those things around attitude, values, people who care, who are interested in what matters to other people and want to find a way to help them live the best life they can. And you can do that in lots and lots of different settings. I think that's probably what I'd like to say.
No, that was brilliant, Linda. Thank you. Because I said that was a tricky question, but I think you've covered it really well. So, Denise, I know you've already mentioned, haven't you, the breadth of the different careers that are available within health and social care, but are there any that you'd like to add?
Well, I would just say that as a diagnostic radiographer, I'm part of a community of allied health professionals, and there are 14 professions in that. And I understand you've heard about podiatry this week, yeah, which means that there are at least another 12 out there to go and explore. But if I may, I might just say a few words about how to try and get into some of these careers, because I think that's a really important point as well. You've heard about the experience, but some of the qualifications as well, I think it's important to acknowledge. So we've got the traditional routes where people have come through college or through school, but we've got the new T levels coming soon, which are technical qualifications for people that would be interested in health and social care. And that is a great way to come in. But if you're not if you're not at school, or if you're mid-career and you're thinking about changes, there are some free courses that people can access. If you have a look through something like Future Learn, there'll be all sorts of opportunities that people could to try something out, probably online, to see whether there's the opportunity there and it's of interest. But we've also got money coming through for people to be able to take out almost a loan, really, to develop themselves through skills. And that's really important and ties in with what Toby was saying earlier on. We absolutely know as a country that we need to upskill people. And my own research has shown that if you're going to be successful in a career, one of the best ways to do that is to make sure that you understand what that career looks like and understand what those opportunities are going to be. So Linda's point about that virtual work experience, or Jackie's point about volunteering, those are absolutely the way to go. And there's some great opportunities. The nursing associate is a role which has just really exploded over the last 3 years. We've got a fantastic community of nursing associates, and it's a registerable profession that leads people into nursing. If they want to go, it's available as an apprenticeship. So be looking at the local NHS websites for opportunities. Be looking at those government websites about finding apprenticeships, because those are brilliant stepping stones to coming into those own careers. And I will just say that we do have an open day at the University of Derby, but it's at the Derby site on the 3rd of July. So if people are interested in finding out more about anything, and as I said at the beginning, whilst we're there to teach people how to become nurses or radiographers or occupational therapists, we can also give some advice about how to get yourself ready for that as well, if you think that's a trajectory that you'd like to go on. So come along. From a personal perspective, I've met some fantastic people who have made brilliant nursing associates, assistant practitioners, occupational therapists. What they've lacked has been the opportunity. And I think what we're talking about today is giving people the opportunity to get into any kind of career in the sector and to be able to come and make that difference.
Denise, that was wonderful. Thank you. We're going to kind of finish off now with a final question about whether any of you have got any final thoughts or advice you'd like to share with the people watching. So anything kind of brief to finish off. Emily, could I come to you first, please?
You can, yes. I mentioned earlier about our ambition to deliver an inclusive approach to growth. And I just wanted to mention one initiative that's been delivered by the Royal Hospital, working with the North Derbyshire Careers Hub. So the Chesterfield Royal Hospital are one of a cornerstone employer. Cornerstone employers work with Careers Enterprise Company and the Careers Hubs to provide strategic support for clusters of secondary schools and colleges in an area. That includes schools supporting children with special educational needs. And as a cornerstone, Chesterfield Royal are taking part in a pilot with North Derbyshire Careers Hub, where they're working with a special school in North Derbyshire to undertake, it's a pilot, but to undertake some virtual work experience for students with special educational needs. And it's really all part of a drive to help widen access to work experience for students with special educational needs. So I wanted to mention that, given that we've got an ambition to deliver inclusive growth. And I suppose in terms of advice for anyone looking to enter a career in health and social care, if you're unsure, please speak to a careers advisor. So whether or not you're just starting out or you're an adult looking to reskill, careers advisors can support with skills assessments that actually look at your own individual skills and match those to potential careers. So if you're unsure, then there are people there to assist with that. So
thank you, Emily. Thank you. And Denise, have you got any final thoughts?
Absolutely. To everybody that's sitting there thinking, I can't possibly do that, of course you can, because we've all had that moment where we thought we can't do it. And so I went to the local comprehensive school, didn't have any idea about a career in health and social care, fell into it by accident, never in a million years dreamt that I would climb all the way up to working in a university. Nobody had ever been to a university in my family. And I've met a lot of people that think that they're not capable of doing it. And I'm here to tell you that you absolutely are. What you need is the opportunity and support. So don't dismiss the talent that you've got.
Oh, Denise, that's wonderful. Thank you. Linda.
Yeah, wonderful. What Denise just said. I think I'd like to just draw attention to the fact that there are lots of non-clinical roles in health and social care as well. So even if you're sitting there thinking, well, I can't really imagine myself as a nurse or as a direct carer, but I would like to work in an organisation that really is doing something important and to feel like I'm giving something back, then we have a huge range of non-clinical roles. Everything you could think of: finance, business development, marketing, communications, HR, all those kind of roles. So don't just think that it's only about the caring roles. And then I would say, if you are interested in a caring role, do try and do a bit of research into the different opportunities, because not everyone is cut out for nursing. Not everyone will become a nurse, but there are so many other different opportunities where you can make a difference to people, care for people, and help them lead better lives. So do some research into all the various things. Don't just go with the obvious thing that you know about already.
Thank you, Linda. That's great. And finally, Jackie, have you got any brief final thoughts for us? You're going to need to unmute, Jackie. Jackie, you're still muted.
We go. We go. So yeah, my final thoughts. I've got a couple actually. My most important message, I think, is if you're looking for employment and you're looking in this sector, be positive, be enthusiastic, be helpful, caring and forward thinking. Your personality will take you a long way in your career. And a great example of that is one of the new careers available in health and social care is social prescribing. So it's a caring role that uses the social prescriber's personal skills to work with a person to look at their own skills and interests, not their deficits. So they might come to us from a clinician with something that they feel is negative in their lives, but the social prescriber looks at the positives and expands on those positives to help them to be better socially connected. So it's a fabulous role where you can really make a difference to somebody's lives. And then my second point is well, whenever you're in a career, look at how you work together. So working together gives real opportunities to understand your colleagues and partner organisations' roles. So if you are in a profession now, look outside that profession, look at other organisations that work around you. We've got fabulous, as an organisation, relationships with Chesterfield Borough Council and public health colleagues. We work together as a collaborative in Chesterfield to develop new services in Chesterfield, and that's really, really important. And then my very last comment, I promise I'll be quick, is just reflecting on Emily's comment about raising awareness. Just an ask to everybody, if you're out on social media, help us by retweeting, follow some community and health organisations, promote their activities, opportunities, and send out health messages. And there's lots of COVID health messages out there at the moment that are coming from public health through DVA, through community champions. And it's great if people can see those and retweet them. And that's the way we'll get back into normal life after the pandemic.
Well, thank you all very much. I have thoroughly enjoyed this last hour. This discussion's been absolutely fascinating, and I think this is, this panel, the wealth of knowledge and experience here is really obvious, and the fact that you all come from a different sector of health and social care and work in different places, but we are all here together, I think sums up just what Jackie was saying. It is about working together. So at Community Chesterfield, we really appreciate you joining us on this event. So thank you all very much.